Hello, I'm Dr. Matt Dahlquist, Gateway Veterinary Hospital, Portland, Oregon. Today we're going to talk a little bit about heartworm disease. Heartworm disease is mostly a disease of dogs in North America. It is transmitted from wildlife reservoirs of coyotes, raccoons, bears, seals. Cats can also pick this up, although the incidence is about 1% of the dog rate. Here we are in Portland, Oregon. Go back to 1970. Heartworm didn't really exist here. It only came in with non-resident dogs from out of state. By 2000, we were starting to see about 500 cases annually in Oregon of resident dogs. By 2010, that had climbed to about 1,000. And it increased roughly to about 2,500 by 2020. From the period of 2018 to 2023, it grew to over 33% higher rates. The main area of infection in Oregon is Portland Metro, out to the coast, along the Columbia River, over into Longview, and then points south of Eugene and out to the coast. We see some in Bend and Eastern Oregon. And as I said, for cats, they can get infected, so can people. The cat rate is about 1%, so there's probably something like 20 to 30 cats in the state of Oregon that are infected with heartworm. So far, those have mostly been found Roseburg, Grants Pass, Medford area. The incidence is growing, 10% year over year, generally in the Portland metro area. It's a serious condition of dogs, can cause heart failure. And once it gets established into the wildlife populations, the coyotes, the raccoons, bears, and the wildcats in the state of Oregon, it'll become a huge problem, much as it is along the Gulf Coast where it originated, along the Mississippi Basin to which it spread during the 70s, along the East Coast also where it spread during the 70s. So, and those states see 30 to 50,000 cases a year. So the disease is caused by, it started off as microscopic worms that get injected in the blood by mosquitoes that are feeding on animals. These little microscopic worms float around the blood for about 6 months before they settle in the heart and grow to their adult size. The females can be over a foot long. The basic cycle is an infected animal with male and female heartworms produces microfilaria, little microscopic baby worms. Mosquito comes along, bites them, sucks up those little baby worms. They float around in the mosquito, go to the salivary glands. The mosquito bites the next animal, transmits it into them, and starts the cycle over again, where they cause a lot of damage to the heart, cause heart failure. Prevention is via medications such as HeartGuard, Interceptor, Simparica Trio, Trifexis, Credelio. So these are all microflaricides that kill the baby heartworms that might be floating around in the blood. We don't want to give these to an infected dog who has a lot of heartworm because it can produce problems. So we do the testing to make sure that we don't have adult female heartworm. The testing is an antibody test, an antigen test, monoclonal antibody detecting antigens for adult female heartworms. There's also what's called a NOTS test, which is a filter paper that takes a sample of blood and then concentrates that and catches out any microfilaria that are present, and then we count them on a microscope. But if there are very few, we may not catch them. The manufacturers of all of these preventatives require annual testing and regular dosing in order to guarantee their products. If your dog is infected, found to be positive for heartworm, or any of the other worms they cover, they will cover treatment provided that you are complying with the every month dosing history and annual heartworm testing. We have a couple of different medications that are effective for treating heartworm. The series is a set of different medications that runs about $1,000 over a couple of months of treatment.